Good morning to my respected Dr. Chen Norma. I'm Louisa Chong and today I'm here to present the cardiovascular system. This presentation focuses on the mediastinum, pericardium, and anatomy of the heart exteriorly and interiorly. Basically, for our cardiovascular system to function, the blood will pump out from our heart and be transported by a vascular system consists of a network of blood vessels. That's why it's called cardiovascular system, because it's a combination of your heart and the blood vessels to carry out function. First of all, mediastinum is a midline where it's narrow and separated into left and right pleural cavities. The mediastinum extends from the thoracic inlet until the diaphragm and from the back of the sternum to the 12 thoracic vertebrae. It can be divided into superior and inferior part. And your heart is located in the middle mediastinum. Some clinical correlations including mediastinal syndrome, atelectasis, and pneumothorax. Mediastinal syndrome develops when the lymph node in the superior mediastinum is enlarged and compressing the mediastinal contents. Atelectasis occurs when there's not enough air coming into your lungs or when there's an outside pressure pushing on your lungs, causing them to collapse. But in contrast, pneumothorax occurs when the lung is injured and the air may leak into the lung, causing them to collapse. So logically, if pneumothorax happens, the affected site will keep expanding and shift the mediastinum to the normal side, and vice versa for atelectasis. Our heart, such a vital and indispensable organ, is protected by a protective layer called pericardium. Pericardium helps to restrict the excessive movement of the heart and acts as a lubricated container for the heart. And I'll talk about the lubrication in a few seconds. The pericardium consists of 3 layers. The outermost called fibrous layer, and the inner serous layer consists of parietal layer and visceral layer. Note that the visceral layer is just beneath or next to the pericardium, so that's why it's also known as epicardium. It's part of your heart. So in between the serous layer, there's a pericardial cavity filled with pericardial fluid, which is secreted by the serous layer. And this fluid will prevent the friction produced when your heart is pumping. The fibrous and parietal layer is innervated by phrenic nerve, and they are sensitive to pain. Whereas the visceral layer is innervated by autonomic nerves, hence it's not insensitive to pain. Here comes the last part of our presentation, anatomy of the heart. We know that our heart is as big as our fist, but how about position? I know it sounds a little bit weird, but it's true. Just grab a dustpan, and that's basically how your heart sits in your body. Anterior, base, diaphragmatic surface, left pulmonary surface, right pulmonary surface, the inferior margin, and the apex of the heart. Surface marking can be done with 4 points. The upper border of the third right costal cartilage, and the lower border of the second left costal cartilage, 6 right costal cartilage, and all these are 1 cm away from your sternal margin. The apex of the heart is marked at the 5th intercostal space, where it's 9 cm away from the midline. And now we're looking to the interior part of our heart. First, the right atrium. There are smooth and rough parts in the right atrium. What makes it rough is because of the musculi pectinati. And there are 4 openings for superior vena cava, inferior vena cava, tricuspid orifice, and coronary sinus. As a node, which acts as the pacemaker, is located at the upper end of sulcus terminalis, where the atrioventricular node is located at the lower end of the interatrial septum. Blood flows from superior vena cava, inferior vena cava, and coronary sinus will drain into right ventricle via tricuspid valve. I would like to highlight the rough part of the right ventricular, where moderator band is present. The moderator band connects the interventricular septum to the anterior papilla to prevent overdistension. Left atrium forms the base of the heart, and the entire interior part of left atrium is smooth, except the auricle. And again, what makes it rough is because of the musculi pectinati. And left atrium channels its blood into the left ventricle via bicuspid valve, or we call mitral valve. Left ventricle has wall that's 3 times thicker than the right ventricle because it pumps the blood to the entire body rather than just the lungs. And there are left and right coronary sinus, where the coronary arteries are connected and drain the oxygenated blood to the heart muscles. What happens if there's a blockage in the coronary artery? Blocks the supply of blood, and insufficient oxygen provided to heart muscles will cause ischemia and myocardial infarction. Myocardial infarction and angina is totally different things, although both of them are grouped as coronary artery disease.
Myocardial infarction causes permanent damage to the heart, and there will be a reduction of blood flow for a longer time. Rest and medication usually have no effects on the myocardial infarction, and emergency care will definitely need it.
Whereas angina will not causing the permanent damage to your heart, and the reduction of blood flow is shorter. Rest and medication will help to improve the situation, help to relieve the pain, and emergency care usually is not required. That's all for my presentation today, and thanks for your time.